Good day, everyone. Welcome to the Just Us Coordinating Council Speaker Series. My name is Dr. William Arnold, and I use he, him pronouns. And I am the Director of Justice and Reentry Initiatives at Memphis for All in Memphis, Tennessee. I'm also a recent graduate of JLUSA's new training program, Leading with Conviction Plus, and I'm honored to be here with you today as moderator for what will be a dynamic and empowering conversation as part of the JCC's Federal Speaker Series. The JCC, as you may know, is the first of its kind national policy table created by and for individuals impacted by the criminal legal system. Over the course of the last 3 years, we have built a table where everyone is welcome and all who are invited have a seat. This is a table where collectively we can leverage our lived experience as the expertise it is. Today's speaker series continues a conversation on the many changes coming to basic human need access. These changes already are being felt across the country, impacting vulnerable communities of all kinds, including those impacted by the criminal legal system. Reentry is one of the most vulnerable experiences an individual can face. To help prepare our coalition and community for the necessary actions needed to preserve access to human needs, today's webinar is the second part of a two-part series focused exclusively on state policy implementation and how we as advocates can and must begin including these efforts in our engagement. I'm joined today by experts who work tirelessly to advocate for full access to healthcare and continuity of care by leveraging a wide variety of expertise and strategic tactics that they are here to share with us today. I'd like to welcome Dr. Richard Cho and Kenda Sarafi from Manat Health and Mark Rice from Wisdom. These experts will be building on last month's overview of the many changes being implemented to SNAP and Medicaid. Today's session is meant to provide a deeper understanding of how to advocate to state agencies versus the more traditional legislative advocacy many of us know and leverage effectively. In addition to highlighting these concepts, both of our guest organizations will provide specific strategies they leverage for influencing state agency implementation. The decisions made at the federal level are already reshaping the playbook, but opportunity remains for advocates to reduce harms through developing deeper understanding of state agency implementation and taking action. Before we dive into today's session, I wanted to take a moment to orient those of you joining us today to exactly why the JCC is truly a first of its kind approach to policy. In April 2023, the Just Us Coordinating Council was launched, a national collective led by systems impacted leaders, community members, and national organizations who no longer demand a seat at the table, but are instead building our own. Our why? The voices of those most impacted by the criminal legal system have been missing and or excluded from decision-making tables. To adequately start addressing the harms caused by the criminal legal system, the JCC works to create pathways, access, and resources within each of these policy areas. Our mission is to enhance quality of life for justice impacted individuals and their communities in order to restore human dignity. We do this by dismantling the policies that uphold marginalization that are ineffective. Today's focus, access to health and well-being, is one of the most important aspects of reentry and one that faces new challenges. Health and well-being, by definition, is a concept essential to economic mobility. It's often limited by access, availability, and a wide variety of exclusionary policies. These realities continue to be reshaped by efforts to reduce spending on public assistance programs. Today's session centers on those most impacted as we highlight new policies and resources explore advocacy opportunities, and connect with experts and advocates advancing change. And that's what brings us here today. As I mentioned, the JCC was founded on a new vision of economic opportunity and justice where all systems impacted individuals can thrive. Not only does this require investment and new pathways to training, education, and employment, it also requires making sure we as persons with lived experience have access to the resources to meet basic human needs that allow us to thrive and live healthily. To navigate the high level and regulatory complexities of this work, we are joined by Kenda Sarafi and Dr. Richard Cho from Manat Health. Manat is at the forefront of helping states design and implement transformational healthcare policies, including the critical 1115 Medicaid reentry waivers we have been tracking. Kenda and Richard are nationally recognized for their ability to translate complicated federal mandates into impactful state-level strategies that ensure vulnerable communities don't fall through the cracks during the reentry window. Kenda and Richard, the floor is yours.
Thank you so much. Hoping you can all hear me. So this is Richard Cho. I'm a managing director at Manat Health. And some of you may know me as I worked closely with Justice Coordinating Council and Just Leadership USA in my prior role when I was a senior advisor at the U.S. Department of Housing and Urban Development, where I worked on policies to try to reform HUD's regulations with regard to how criminal records are used to deny people access to HUD-assisted housing. And really grateful for the work that you all do to advocate on behalf of justice-impacted populations. We can move to the next slide. Great. I really want to open this up by talking about where we are in the process of the new work requirements that have been enacted for Medicaid. As many of you know, Medicaid is a joint federal and state program. It's governed by a combination of both federal laws and regulations as well as individual state policies. And it's also funded by a combination of both federal dollars as well as state funds. Medicaid was actually authorized through an act of Congress. It's been changed over the years, most notably in 2010 through the Affordable Care Act that allowed states to expand their Medicaid programs to non-disabled low-income adults. And then most recently was also changed through HR 1, moving in the opposite direction of actually making it more difficult for people to become eligible and retain eligibility for Medicaid. Now, Congress passed the laws that really impact Medicaid eligibility, but many of the decisions about how those eligibility rules are carried out are regulated by the federal government through the Center for Medicare and Medicaid Services, and they will be issuing guidance that's forthcoming on how states need to comply with these new work reporting requirements and twice-a-year eligibility redeterminations. And Kenda will speak a little bit more about those. Where we are in the process now is that many states are now in the process of developing their procedures and processes for how they're going to comply with these work requirements. And that work really happens by the executive branch agencies within state government, and that's your state Medicaid agency. Every state has an agency that's responsible for implementing their Medicaid programs. And I think really where the focus of advocacy needs to happen at this moment is really with your individual state Medicaid agencies who are really responsible for carrying out those work reporting requirements and eligibility redeterminations. Secondarily, many state legislatures also have some jurisdiction and roles to play. But in this case, they would be kind of a secondary target. In most cases, you want to focus on advocating with your state Medicaid agency to implement these work reporting requirements in ways that tries to mitigate the losses of coverage for people, particularly those that are justice impacted. But you can also engage some of your state legislators to try to use their influence to convince your state executive branch agency to try to pass policies to the extent that you have allies within your state legislatures. Next slide, please. So I want to just open up with a few kind of do's and don'ts for how to really engage your state Medicaid agencies. Now, as you know, political priorities may differ from one state to another. In blue states, I think many state Medicaid agencies are focused on trying to minimize the losses of coverage among people who are enrolled in Medicaid, and they're looking at ways that they can ensure that people are maximally exempted from these work requirements, or where people can be notified to the extent possible about how they can meet their work requirements and also continue to remain eligible for Medicaid. In other states, they may be more focused on imposing these work requirements. But at the bottom line, I think most state Medicaid agencies are concerned about coverage. They're concerned about costs. They're also concerned about administrative complexity and also program integrity. I think it's worth doing some background research to understand what your individual state political context is and get to know who your state officials are and what their priorities are. But I think across the board, do's and don'ts are, first and foremost, I think it's important to remind your state officials that under the law, under HR 1, people who are currently incarcerated or who have recently left incarceration, specifically in the last 3 months, they're legally exempted from work reporting requirements. Another sort of do is to engage your state criminal justice leaders and state policymakers who've been supporting policies and programs that help support successful reentry and that are focused on reducing recidivism, and to really build alliances with those leaders and policymakers to ensure that they're aware of how these new Medicaid policies could really, I think, interrupt with the success that's been made with regard to reentry programs and policies. Also, it's important to highlight the unique challenges that justice impacted people face in meeting these work requirements, and also the twice-a-year redeterminations. Real life stories are really important. People need to know the concrete ways that these work reporting requirements can interfere with people's ability to retain access to healthcare, and also how losing healthcare will interrupt their recovery from addiction and contribute to their higher rates of recidivism. A few don'ts is to not approach your state officials as if they're the enemy or they're the cause of the problems. In many cases, your state Medicaid directors and officials, they're not the ones who wanted to impose these work requirements, but they're now legally responsible for helping to carry that out. And so, always important to treat people with respect and try to assume that their intentions are to try to not help people lose their coverage. And also do a bit of homework on learn what your state's already considering. Many states are already in the process of trying to develop ways that they can mitigate the coverage losses as a result of these new work reporting requirements. And also try to build on what states are already contemplating. Avoid ideas that are administratively complex. Things that add to state kind of time and resources is not something that states are more willing to do, but really focus on concrete ways that you can assist how state corrections agencies, county jail data, how reentry service organizations can all contribute to ensuring that people are getting the information they need on how to meet their work reporting requirements, and also to continue to remain eligible as they have to undergo redeterminations twice a year now. And then last but not least, don't assume that a one-time advocacy effort is sufficient. This is going to be an ongoing process, and I think many states will be evolving in their implementation. So be persistent, be continuous in your advocacy, and certainly ask your state officials for follow-up information as you do your advocacy. And with that, I'm going to turn this over to Kinda Sarafi.
Great. Thank you so much, Richard. So, and first of all, it's such a pleasure to be with you all. Thank you so very much for having us. I'm going to just jump us to the next slide. Richard gave us a nice preview of the work requirements. But let me just take a step back. And for those of you who are not in the deep weeds of Medicaid, I'll just sort of share with you, I think the sort of broad rules are, my name's Kinda. Kinda applies in New York because that's where I live. And I have to demonstrate that I live in New York, that my income, if I'm an individual in a household of one, is less than $17,000 a year, that I'm a citizen or I'm a qualified immigrant. And based on that, then I get to determine that I'm eligible for Medicaid. If I meet all those rules, I'm in. What Congress did is it basically said, that's not going to be enough anymore. And if you are an adult who's under the age of 65, you're not disabled and you're not elderly and you're not a child and you're not pregnant, now you have to prove that you are working or that you are exempt from work. And what that means is that you now have to show that you are meeting an 80 hours a month requirement. So that I'm working 80 hours, or I'm volunteering for 80 hours, or I'm participating in a work program. And that basically is going to mean that so many people who would have normally been eligible for Medicaid are going to get disenrolled from coverage. It's so significant. It's going to have such a major impact on coverage and continuity of health care. And so what we want to do is really try to figure out how we can mitigate harm. I think the estimates are that more than 5 million people could lose coverage because of these new requirements. So let me go to the next slide and just tell you that not everybody has to be subject to the work requirements. That Congress really tried to identify people who it wanted to protect from coverage loss. And so this is a list of people who are exempt. So if you're a parent and you have a kid who's 6 years old, because that's under age 13, you're exempt. If you're a Native American, Alaska Native, you're exempt. Pregnant people, you're exempt. And very importantly, the Congress was very intentional about exempting people who are incarcerated and people who have been released from incarceration within the last 90 days. So if I was released on January 1, then that means that January, February, March, if I'm applying in April, that means that I was released in the last 90 days and I would be exempt. And then in addition to those two very important exemptions, there are other exemptions from which we think people who are justice impacted would also potentially meet, such as people who are currently in a drug addiction or alcohol treatment program, have a substance use disorder, may have a disabling mental disorder, or more importantly, might have a serious or complex medical condition. All of those people are exempt. The policy is protective of justice impacted people. The rubber's going to hit the road on how states actually operationalize these exemptions. And that's what we want to just spend a little bit more time with you, and then we're happy to answer questions that you have. So if you go to the next slide, I'll just sort of say, if you want to pop into the next one, the way that it's supposed to work is Kinda fills out her application. She provides information. Let's say that I'm in a substance use treatment program, and I give my name, my income, my residency, my citizenship, immigration. Okay, check. Kinda is enrolled. She's under 65. Now she knows she's got to be subject to work requirements. And I say I'm in a substance use disorder program. That should exempt me if I say it on my application. But what states are going to do first is check to see if there's any data that verifies that. Like, oh, can I see in my claims data, my state system data that Kinda is in a program? Likely not if I've never been involved in the Medicaid system. But then the question will be, is the state going to require me to show documentation of my substance use disorder program participation, or will they accept that I said that I'm in it and that's good enough? That's going to be the open question on whether states are going to just rely on the data, which might not be good or available, or will they trust me? And this is something that we're still waiting to see what states will have in terms of their options. We'll go to the next slide. I don't think this group needs to know it, but it is good for you to have in your talking points with their state Medicaid agencies, as Richard was laying out at the top line, on why this matters. And how a state operationalizes these exemptions is really, really important. Well, first of all, we all know that the post-release period is a very high transitory time period. It's also a very dangerous time period. People sometimes experience overdoses. They get treatment in the emergency room. This is an extremely important period for us to make sure that Medicaid coverage is continued. We know the research is well documented that individuals who are justice impacted have disproportionately higher rates of behavioral health needs and healthcare needs. And we also know that people who are justice impacted have a stigma when it comes to getting employed. And so if we're asking people to demonstrate their employment, we have to take into account that this is a very, very difficult time and a difficult way to get hired because of their incarceration history. So these are talking points for you to have on the why a state really needs to honor Congress's intent for exempting individuals. Move us to the next slide. I know there's a busy agenda, so I'm going to keep us going. So let me tell you a little bit about how you can urge your state Medicaid agency on the importance of operationalizing this right. So the first is that anybody who says that they are an inmate and they're submitting a Medicaid application, that should be someone who's automatically coded in the state system to exempt them from work requirements, full stop. There is a way in the state system where they suspend people who we know are incarcerated if they already have Medicaid and they become incarcerated, and states should use that suspension system to tag people as exempt without requiring someone, the person to provide that information. In other words, the state knows if someone is incarcerated and already enrolled in Medicaid because they've tagged them already. They should use that information. Then we should use that information to track release. So every state should have a process where they've unsuspended people upon release. It doesn't work well in a lot of states. It's still a building process. But basically, we should, and it's required under federal law, to have people who are unsuspended in release have that in the system coding for a Medicaid agency. So as you can see, it's highly technical, highly operational, but it really all matters if the state Medicaid agency is building to the information that they have so that we're not relying on individuals themselves for reporting this information. We're actually using available information that the state has to automatically exempt individuals. And where we don't have data, we should trust people to say, I was incarcerated within the last 90 days, and that should be good enough, and then we'll exempt them. Okay, so we really need to exempt people who are inmates. We really need to exempt people in that 90 days post-release incarceration so we can have continuity of Medicaid coverage. The problem is we don't want to have a cliff, right? Like we don't want to get to a place where after those 90 days, we've lost them. So that's the real work, is being able to help people continue to be exempt after those 90 days and making sure that if they have a substance use disorder or they're in treatment or they have a mental health condition or they have a complex condition, that they are able to provide that information to the state so that they can continue to be exempt from work requirements. This is really important. We need to really make sure that individuals understand their exemption and that anybody who is working with a justice impacted individual is able to advise them of their exemption and then communicate that information to the state so that they don't lose their health coverage. Let's go to the next slide and just talk about engaging partners. So there's a multi-pronged strategy. The first is we got to really put it on the state to figure out their systems and get it right and build it so that we don't lose people. The second is that we have to have an all hands on deck approach. So people should make sure that we are referring people to employment assistance when we can. So anytime a Medicaid agency has connection to a work program, that we're using those referrals and that infrastructure. So if they don't have an exemption under a medical frailty or they're outside of that 90-day post-release period, that they are getting connected to employment so they can meet the work requirements. And people who are employed, we want to make sure that they are getting help proving that they're employed and providing those 80 hours a month so that they can then be found compliant with work requirements. If you go to the next slide on 9, we do think that it is really important that you push your state Medicaid agencies to work with trusted messengers and trusted partners. We know that the most successful programs for justice impacted individuals are people who work with other people who've had lived experiences and understand how to navigate a very complex system. So we want to make sure that you are going to state Medicaid agencies and saying, use us as your trusted messengers. We want to collaborate with you on really effective outreach strategies. We're going to be helping individuals understand the compliance requirements of the 80 hours a month. We want to make sure that they understand what the exemptions are, and we want to make sure that language is plain and understanding. Okay, I am going to pause us. I'm happy to answer any questions at the end, but I'll just say all of this is coming in 6 months. This will all be effective in January 1 of 27. So this is happening right before our very eyes, and we're going to be waiting for guidance from CMS, from the federal government, that should come in the next month or so. Okay, I'm going to pass it all to you, and then happy to answer any questions as they come up.
Thank you so much for that information. I have a question for Dr. Cho. During your time as a federal agency senior advisor, when outside groups were advocating for changes to public housing authority screening rules or the 1115 waiver integration, did you find formal comments, direct stakeholder sign-on letters, or community-led storytelling to be the most effective driver of internal change?
Yeah, that's a great question. I think all of it is important, but it also depends on the context. In the case of where federal or even state regulations are being changed, where either the federal agencies or state agencies are required to receive public comment, then those official comments that are submitted are really important. They actually go into the record, and the government agencies that are changing the regulations are required to review all of the public comments and take that into consideration and actually respond to those public comments. So that formal commenting process is really important. In the case of state agencies, I think that hearing real life stories is also important. Some of that depends on if you have state officials that are kind of sympathetic to the needs of the population, then hearing those stories will enable them to think through and design policies and procedures that can take into consideration the kind of life experiences that people face. The sign-on letters, I think, may be sort of less important. Those are more important, I think, if you're mounting advocacy for the legislative branch, whether that's Congress or, in this case, state legislators. Those sign-on letters can often signal to your representatives in the State House or in Congress that this is an issue that's important to constituents, and then they can use their influence with executive branch agencies to make those changes. In the case of these Medicaid work requirements, I think what's going to be really important is, again, telling those stories. I would say telling those stories both directly to your state agencies as well as in the media, because I think that is what many state policymakers will pay attention to. And then again, if there are any formal public comment processes, don't hesitate to submit those public comments in the case where states are actually formally soliciting those. But again, I'd say, a sign-on letter is not always going to be the most effective when it comes to your state agencies who are actually shaping policies and procedures. Really engaging them directly with stories. And then again, don't be afraid to use the media to tell those stories as well.
Okay, I appreciate that clarity. Thanks again, Richard and Kenda, for joining us. For those in attendance, please feel free to use the chat button to ask additional questions of our speakers today. We will answer your questions both in the chat and in real time before we end today's session. Next up is Mark Rice from Wisdom. Wisdom is a dynamic statewide network in Wisconsin that anchors its advocacy in the shared moral values of faith communities. They've been instrumental in uniting diverse congregations to challenge the systemic injustices of mass incarceration through both relational organizing and policy reform. Mark Rice, who leads their transformative justice campaign, is also a founding member of the JCC, brings a profound depth of experience in mobilizing directly impacted leaders to hold state agencies accountable to the humanity of the people they serve. Mark, thank you for joining us today, and we look forward to learning more from you.
Thanks for the introduction, Dr. Arnold. So I'm going to be speaking about a campaign that Wisdom and our numerous partner organizations across Wisconsin led that expanded access to healthcare for incarcerated people in Wisconsin. Go to the next slide. Wisdom is a statewide network comprised mainly of faith-based organizations. We also organize formerly incarcerated people, immigrants, and in the past have organized other constituencies such as transit riders. We have 12 affiliate organizations all across the state, all the way from Eau Claire in northwestern Wisconsin to Kenosha in the southeastern corner of the state. And we have 3 primary statewide campaigns right now. We build campaigns that focus on immigration policy, environmental policy, and overhauling Wisconsin's carceral system. In addition, each Wisdom affiliate organization organizes numerous campaigns at the local level, at the city, county level. So we have additional campaigns through our 12 affiliate organizations. Can move on. So as Dr. Arnold mentioned, my current role is I serve as the coordinator of Wisdom's Transformational Justice Campaign. And a major focus of mine is investing in the leadership and development of directly impacted people and people who have loved ones who've been directly impacted. Here on this slide, we have 2 of the key leaders of the Transformational Justice Campaign in Wisconsin. On the left in the yellow shirt is Vente Pero. He serves as the Transformational Justice Campaign lead organizer. He's based in Milwaukee. Here, he's speaking at a community forum that he organized in Milwaukee and has really done a great job of building the base of directly impacted people, particularly in Milwaukee, but also throughout the state, and has assisted with the coordination of trainings. And then on the right in the suit, dressed sharp as always, is James Morgan, who's the lead organizer of Moses in Madison, which is really a key organization. And James is also directly impacted. Both Bente and James have been directly impacted by the Wisconsin prison system, served many years in the state prison system, as well as have been under the supervision of the Department of Corrections in the community. But the Moses organization is really key for any legislative campaign or any administrative policy campaign at the state level, because they're based in Madison, where the state capital is in Wisconsin. So they're constantly showing up deep at the state capitol and testifying at legislative hearings, meeting with legislators. And so definitely wanted to give a shout out to the Moses organization and the great organizing of James Morgan, who's been doing this a long time and has really been exemplary and shown exemplary leadership on this. But move to the next slide. The transformation, and here is another leader I want to acknowledge with the mic is Wisdom Vice President Talib Akbar. Talib, another directly impacted leader of the campaign. He also chairs and coordinates the Wisdom Solitary and Conditions Confinement Task Force, has really done a lot for over a decade now in terms of moving this campaign forward around conditions of confinement, solitary confinement. And so Wisdom's Transformational Justice Campaign has 4 primary goals. We're working to advance racial and economic justice in the state of Wisconsin. We have always, since 2011, we've been working to cut the state's prison population in half by advancing common sense decarceration policies. We also do a lot of narrative shifting work. We're working to shift narratives that dehumanize systems impacted people, and we have a major campaign that aims to shift, to reimagine how we build safer, stronger, and healthier communities in the state. And also rights restoration and ending permanent punishments of people with records is another big bucket of issues that we work on, such as ban the box for the box on job applications. We had numerous campaigns at the local and state level and joined a national campaign back in 2015. Can move on. Next slide. Okay. So it's for this campaign, it's really crucial to understand the Wisconsin political context that we're working in. So Wisconsin has been a very difficult state to move a lot of these common sense policies forward. There's been very strong opposition to any type of Medicaid expansion from Republican legislators, particularly former Robin Voss, who's a state representative, was the leader in the state assembly for many years, just recently announced that he's stepping down. But for many years, he led the charge in blocking any type of Medicaid expansion in the state of Wisconsin until this year. We'll get more into that story, but there's been Republican majorities in the state assembly and the state Senate. So they really have had power to block a lot of this legislation around healthcare expansion. And then so Wisconsin Governor Tony Evers has been very reluctant to utilize his executive authority to advance policy change in the legal system. He's been in there now for 2 terms. He's finishing up his 2nd term. He's not running for re-election. So there's going to be a new governor in Wisconsin in 2027. We're doing a lot of engagement with candidates for governor. We have a big candidate forum coming up on June 22nd for all the candidates for governor have been invited to that. But Evers, just for the last 8 years, we've been working to get Tony Evers to utilize his authority to commute sentences. And he just recently restored the commutations process in the state after a 25-year pause, but could have done that 8 years ago. And so has been reluctant, really wanted to work in cooperation with Republicans to advance a lot of changes, and has not really boldly utilized his executive authority nearly to the extent that he could. So that was that's some of the important context to understand about this campaign. Can move on to the next slide. So the origins of this healthcare expansion campaign, from my perspective, when I first started learning about it, I was, as Dr. Arnold mentioned, I'm a founding member of the Just Us Coordinating Council. And as part of that, I was invited to present at a U.S. Senate briefing in April of 2024 for Fair Chance Month activities. And I presented on health equity policies, and started at that time. The Just Us Coordinating Council had recently done a new report and released some recommendations. And that was the time I learned about the Medicaid Section 1115 reentry demonstration waivers. When I was preparing to testify at this hearing, I had conversations with Deanna, the CEO of Just Leadership USA, and also Zach, who really educated me about that. I hadn't heard of this before. So it was really exciting to me that, learning about this opportunity to potentially get expansion of healthcare for incarcerated people during that critical period of 90 days pre-release. And then started having conversations with key leaders in Wisconsin about how we can actually move this forward in Wisconsin. So certainly leaders from Citizen Action Wisconsin were at the top of my list, who've been leading the charge on healthcare policy and Medicaid expansion in Wisconsin for many years. And, we started to strategize. At the time, in 2024, it seemed like it was going to be a really difficult, almost impossible battle due to that, Wisconsin had never done any type of Medicaid expansions and all these for many years, ever. So, but we decided to start organizing, and I'll get into that. You can move to the next slide. So, eventually, what came out of it was a bill called Assembly Bill 604. That bill was introduced in November of 2025. And so now it was passed, enacted this year. It's now 2025 Wisconsin Act 303. And the bill requires the state of Wisconsin to apply for the demonstration 1115 reentry waiver by January 1st, 2027. The project will provide eligible incarcerated people with up to 90 days of pre-release healthcare coverage. That coverage will include case management services, medication-assisted treatment for all types of substance use disorders, and a 30-day supply of all prescription medications. And so here on the right, definitely want to acknowledge Wisdom co-director, Reverend Miller, who's been a leader of Wisdom since the beginning for many years. And it's really, definitely done a lot around, this campaign around transformational justice, and definitely want to acknowledge her leadership and many religious leaders behind her. So definitely it's a transformational justice is a coalition, a collaboration of, led by directly impacted people, but we also, we organize people who have loved ones who are, and have been incarcerated or who are currently incarcerated, and also collaborate a lot with religious leaders and people who are members of congregations throughout the state of Wisconsin and other community leaders. So we can move on. So here is one of the key strategies, certainly is, really amplifying the voices and the strategies of directly impacted people. One of the key leaders of this particular campaign to expand healthcare coverage is Wisdom leader Tom Dank. He's actually the co-president of Esther in the Fox Valley, one of our affiliates that's up in the northeastern part of the state of Wisconsin, and has, certainly been directly impacted. So here's one of the quotes that he had about why this bill matters. And, a lot of this has been amplified by the media. We get out and do a lot of media, engagement with written media, with radio shows, and get on TV shows. So Tom said that when people don't receive support, they tend to go back to what they knew. One of my best friends was in prison with me. It was his 10th time in prison, all for substance use issues. However, after he was released this last time, he died from an overdose. Medication and access to medical care will literally save lives. So, here's some of one of the original statements that I released that included that some of the ways of with the full implementation, and implementation is certainly key, and we're going to get into that later, but the full implementation of this bill would potentially reduce needless suffering in jails and prisons, put more people on a pathway to successful reentry, reduce the number of people being detained, enhance public safety, and also save resources that could instead be utilized to build stronger, healthier communities. Can move on. So here's some of the campaign strategy and tactics from our perspective. We decided to primarily pursue a legislative strategy for this campaign because of Governor Evers' reluctance to use his power to boldly advance administrative policy changes. And also mentioned that there will be a new governor in the state of Wisconsin in 2027. And the next governor could reverse any administrative policy change. So it'll be totally under the purview of the next governor. So, with Evers, definitely there's been many opportunities to utilize his administrative authority that he's decided not to utilize. So that is the background on that. And then, some of the tactics that we utilized included educated wisdom members via email blasts, urging them to contact their legislators, and many followed through. So we have a real large statewide base of people all across Wisconsin, which is really key to pushing statewide legislation. We have one of the largest bases that works particularly on transformational justice issues. And so that was really key to have so many people really contacting the legislators, which is, obvious, but it was a key piece of it. And then we organized a series of trainings across the state in early 2026 transformational justice trainings, where at some of those we engaged with some of the key legislators. For example, we organized a training in Eau Claire, and State Senator Jesse James, who's a key Republican who's supportive of this legislation, was there at that. And we asked, we engaged with him around this issue and many other issues, but he was a real champion on the Republican side, which we certainly need in order to push any legislation through in Wisconsin at this point. And also did trainings in Green Bay, Madison, and Milwaukee, and that gave us an opportunity to really have conversations with leaders and to strategize about how to move this campaign forward and other issue campaigns. Also, where we decided to really prioritize this, we also have a statewide transformational justice steering committee that is comprised mostly of directly impacted leaders, but that's really the strategy table for this campaign. And of course, partnering with numerous organizations. It's not just Wisdom, but there's numerous organizations across the state that we partner with as well. So building those coalitions is a crucial aspect. And we organized community forums. I had that slide up about the Uniting to Build Communities Forum in Milwaukee. So Milwaukee has some of the neighborhoods that have been most disproportionately impacted by incarceration in the entire country, predominantly Black neighborhoods. For example, the 53206 zip code, where we had our community forum, by some measures has the highest incarceration rate of any zip code in the country. So Vente, it's really done a great job of organizing some of those neighborhoods, where he's from, and he resides in, one of the most directly impacted neighborhoods in the entire country. And so that definitely gave us a chance, to, amplify the message and to spread the message through community partners. We had over 10 different community partner organizations came out and collaborated with us on that event. So that was another opportunity to build, particularly in Milwaukee, which is a key area. And again, mention amplifying the voices of impacted leaders, which is a crucial component. So we've, sent hundreds of directly impacted leaders to trainings over the years. And, part of that is we often have storytelling trainings, have basic organizing trainings, but, also have that communications component. So do a lot of media engagement and, engagement on social media, getting that message out in all the forms possible, and do a lot of presentations at various organizations, congregations, other organizations across the state. And then, of course, testifying at the legislative hearings. As I mentioned, Moses did a great job of showing up and definitely testifying to Lee Akbar, James Morgan, and numerous other Moses leaders, but also people from all throughout the state, from Wisdom and from many different partner organizations, definitely showed up deep and, shared powerful testimonies about why we need to move this legislation forward when the legislative opportunities came up at those hearings at the state capitol. So you can move to the next slide. So you can see Tom in the back in the black shirt. That's Tom Dank. And then here's the green shirt. Randy Gage is the leader of our Conditions of Confinement and Solitary Confinement Task Force. And then Bev Kelly Miller is here in the pink. And then there's a leader from the Free Organization, an organization led by formerly incarcerated women in the state, which is a key partner organization for transformational justice. So Bev, here you can see the quote, who's, had a daughter who was impacted. So this was a piece that she did. She was very active on this campaign and definitely was speaking at, organizing around it, but also testifying at legislative hearings and doing media engagement. Here's one of the quotes that she had. She wrote this piece for an article that was posted in the Wisconsin Examiner, one of the major news outlets in Wisconsin. So Bev Kelly Miller, who lost her 22-year-old daughter, Megan Kelly, to preventable heroin overdose, wrote that her daughter had an ankle bracelet, but that didn't stop her from using. She wrote that substance use disorder is a medical condition and that using substances is not a choice once you're addicted. She said she wishes Megan was still here, but since she's not, she advocates for others to receive the care that they need to live. And so Bev is, another really powerful leader and, just an example of, those are a few, and there's numerous others that I could have brought in, but then she's from the Esther organization as well in the Fox Cities area. So again, you can see the statewide reach that we have. We're all over the state, which is crucial to moving state legislative change forward. So you can move to the next slide. So again, mentioned some of these. Here's again another panel. We had a couple of panels at the Uniting to Build Communities Forum in Milwaukee on January 8th, 2026. Here on this panel was actually someone who testified in the black shirt there, who's the statewide campaign coordinator for dream.org in Wisconsin, has also been part of the Good Samaritan Coalition that aims to prevent overdose deaths in the state. So he gave a real powerful testimony. And then we had folks that testified on numerous different issues. People from 4 different organizations were there. So it had another 4 from 4 different organizations at another. So we're, amplifying the message, getting this message out, not just to folks that were currently, prioritizing the healthcare expansion bill, but work on other issues, and then, amplifying the voices and building the power of the coalition around it. And, helping people understand that this is something that can really pass this session, because Wisconsin, again, a very difficult political environment. The vast majority of bills we were working on did not make it, did not even get a committee hearing. So this was a, remarkable campaign that it actually passed in a really difficult political environment in Wisconsin. And so we had also a wisdom town hall at the state capitol on November 12th, 2025, where we brought together the 3 statewide issue campaigns, but certainly Tom Dank, again, he testified on the healthcare expansion bill. At that testimony, there was, I believe, 13 legislative offices were present. So directly engaging with legislators and, ensuring that we have those champions that are really pushing our legislative priorities forward. And again, mention those trainings all across the state where we're, strategizing around transformational justice issues, educating the membership about the issues, and planning the next steps that we need to move forward, to move on. And so here you go. Here's my contact information. You can definitely follow us on social media. You see the Instagram, X, Facebook, and there's my contact information, but move into questions.
Yeah. Hey, Mark, thanks for that information and for what I believe was a great example of how to create agency change through legislation. Now that the legislation has passed, how are you and your team involved in its implementation?
Definitely, I mentioned the engagement with candidates for governor. So the next governor is really going to have a lot of power and influence on any type of administrative policy change. We'll have the power to appoint administrative leaders, and will have definitely have a key impact on any type of administrative policy. So we're organizing a gubernatorial candidate forum that will be on June 22nd in Waukesha County, and almost all of the leading candidates for governor have confirmed except one. So that's certainly crucial. We'll be asking them questions about these sorts of issues, about how they're going to utilize their executive authority, administrative authority, so we can inform people, educate people about, those issues and what might be in our interest in terms of voting, and doing a lot of voter engagement, that sort of thing. But also in the past, we've had some real nightmare examples of policies getting passed and not being fully implemented. So we know that we passed a bill in 2013 called Wisconsin Act 196, which aimed to reduce the use of incarceration for technical violations, for revocations without any new convictions, for allegations. And that bill was never fully implemented. So we know from experience that we really need to closely monitor the implementation, and that we really need to ensure that directly impacted people and people who have loved ones who've been impacted need to be at the center of any sort of planning process. So, I mean, that's definitely key, that we need to continue to have that engagement and monitor and ensure that, because the peer support piece is going to be crucial for implementation. So we want to ensure that a lot of these resources are going to organizations that are led by directly impacted people. And so for us, that's going to be a continuing, project to monitor that implementation, and to work with various partner organizations like the Justice Forward Coalition, a coalition led by directly impacted people, and numerous organizations that provide these direct services throughout the state that are led by directly impacted people. I'm also a board member of an organization called Project Return in Milwaukee that provides direct services, does a lot of housing, and provides a lot of direct assistance to people reentering into the community, mainly from Milwaukee. So it's those type of organizations that I feel, CC We Adapt, David Carlson, one of the key leaders from Eau Claire, he's an expert on implementation. So we need to really lean in on his expertise, the expertise of, he's a trained attorney who specializes in this area. So we can, collaborate with and lean into the expertise we have across the states in these collaborations. So I feel like collaboration is key, and to really continue to organize and to let people know about the importance. So it's, this isn't the end, this is just beginning. We need to really monitor. The implementation is going to be really key that will really influence how this actually plays out in the community. We need to ensure that it's fully implemented, and that directly impacted people are at the center, and that our voices and strategies are centered during the implementation. So that's the next step for us.
Hey, man, it sounds like a great way to stay involved with that. I appreciate that, and thanks for being here. I want to go back to Kenda. Kenda, you still there?
Yeah, right here.
Great. All right. Question for you. Is there a centralized network of state Medicaid advocates where those listening can immediately tap in and begin using some of the tactics that you've elevated here today?
Yeah, there are a group of various groups of organizations. I'm going to rattle off a few, and to the extent some of these are familiar to you, these are the ones. And it's the Center for Budget and Policy Priorities, Families USA, and Community Catalyst. Those are the three top national organizations that are focused on Medicaid advocacy. The problem is they'll be great for you to plug in when it comes to compliance activities and exemptions, especially when it comes to the medical frailty exemptions I was talking about. But those organizations are not locked in on the justice impacted specific exemptions, the inmate, and the 90 days. So I actually think that you should join those groups and have them focus on that as well. They don't have the expertise, they don't have the lived experience, they're not tracking this in the same way that they're tracking the others. So we do feel like there's a gap there, and there's a real opportunity if you were to join those national webinars and convenings to put the justice impacted exemptions front and center as part of the discussion and the advocacy.
Great. Thanks for that insight. We appreciate you being here again. And as we draw our time together at the table to a close today, I want to start by thanking again our incredible guests. I'm confident that the resources and expertise shared today will help our network engage in a more meaningful way in the coming months as these policies continue to be reshaped. Thank you as well to each person who joined us today. As someone who deeply values the work of the JCC, I want to encourage you to regularly take time to explore what the coalition sends several times a month via email and on social media. On the final slide is a QR code you can scan to gain direct access to the many resources the JCC has to offer. Also, when you receive your webinar follow-up email, please take a moment to complete our survey so we can continue to bring you the most relevant information for your advocacy. As you heard Mark share today, the opportunities elevated within this coalition can lead to powerful policy shifts for your community. More ways to elevate your experience and expertise are coming this month, and a table is open to all. Thank you for joining us today, and have a great week.